Hello, and thank you for passing by our booth. So my name is Fadi Asad. I am the regional manager for Eizo Corporation. Eizo is a Japanese company, and we are specialized in visual displays. Our healthcare products are comprised of two lines, for radiology and for operating room. Here in ARM, we are showcasing our radiology monitors, which are specific for diagnosis. So this is our flagship monitor. It's a 12 megapixel monitor, Radiforce RX 1270. So it's a multimodality monitor where you can see mammography images and all the rest of the images as well. So as chest X-ray and CT MRI. So what is special about our monitors is that it's manufactured in-house in Japan, 100% in-house development and manufacturing. So our monitors are very ergonomic, so you can easily change the stand and swivel it and turn it. The good point about our monitor is that they do not mirror, they don't do reflection. So you can see, because in our factory we do an additional step in the production, that we do an optical bonding. It's called optical bonding. So we bond the panel to the front protective glass, so it will not do any reflection, which will be good for the doctors whenever they stay for a long period in front of the monitor. So today also I will take the chance to introduce our quality control and quality management solution. So it's very important to know and to understand that every medical monitor needs to be calibrated, because the DICOM curve and the uniformity, the brightness degrades with time and with usage. This is a normal degradation. So you need to calibrate it regularly. So you adjust the curve, the DICOM curve, and you adjust the brightness and the uniformity on the screen. Doing that, it will ensure you that you are getting the optimal quality of the image at all time in the hospital. So I'll show you a little bit about the software that we have. So it's our software is called Radix and Radinet Pro. So the Radix is the calibration for the workstation, and the Radinet Pro is the management calibration. So you connect all the monitors in all the hospital to one administrator. Even if you have multiple premises, you can always also connect it all to one administrator who will manage the monitors in the premises. So this is an example of how the software works. So we have here, it shows that it's connected one workstation and 3 monitors. So imagine that you have like 50 or 100 monitors connected. So you can see all the statistics here, like number of computers installed, number of monitors, what are the models, the usage hours, and even we set some they can send an alert to the administrator that the monitor is not working, or it has a problem, so he can take action. So on top of this, and you can set the schedule for the calibration for the monitors, which is something very important, because this will, here you see the list, so you can select and set the schedule. Let's say you want this monitor to be in this department, to be calibrated at this specific time. So it will automatically calibrate when it's idle. So it will not stop the user when he's working, and it will do the calibration. And then we can retrieve the reports and download them as CSV files to the computers, so that you can use it in case you have any accreditation body coming over to check the quality in your establishment. Yeah, so.
Thank you. Okay, well, thank you for your presentation. And I think I'm seeing a specific type of screens, and I think unifying is your key. I mean, you are looking at a unified visual representation of the images, let's say within a hospital or a premises. This is what you're proposing. And you mentioned something about the calibration. How frequently do you have to calibrate your monitors? And I guess the other question is this compatible with like every modality, every vendor? How does it work when you integrate?
Yeah.
Yeah.
Thank you, doctor, for your questions. So usually the calibration should be done twice per year or one time per year, depending on the load of work on the monitors. But 2 times per year is the perfect and the perfect frequency. As for your second question regarding the other brands, so our software, which is Radinet Pro, it can integrate other brands. We can integrate, we can read other brands, and we can calibrate to a certain extent. We cannot calibrate, we can do some tests to a certain extent. Not all the features can be done on the other brands. This is something unique for us because this software we have developed it internally at Eizo in Japan, and other brands cannot integrate our monitors. So we do the contrary. So we can integrate. So in case you have a hospital or an establishment where you have other than Eizo monitors and you want to take our solution, then we can install our monitors and then integrate the rest of the brands here. So you don't lose. So you can keep track of even the competitor brand. Yeah, sure.
First of all, thank you very much for your presentation. Apart from calibration,
Yeah.
as I know, ISO taking care of screen, and I'm looking at that breast image over there.
Yeah.
So what is on the way to improve image resolution? It can be diagnosed and not to miss anything, because as we know about breast, if you're looking at it, you know, small, when we are looking for small lesion, it's as if like we are trying to find a fly in Amazon.
Yeah.
Okay, so what do you think? What's the future for breast reading using your? What's the pixel value you are looking for in the future?
Okay. Thank you, Dr. Ali, for your question. So as I mentioned before, so we are focused on providing, you know, there's something very important that we try to educate the community about it, is that the monitor is the last point of contact between the patient and the doctor. So if you have the best image and you are not using the best monitor, then the doctor will not be able to do a good diagnosis. And this is something very important to consider whenever somebody or some establishments need to invest in equipment. So, replying to your question, so you know that the size of the image, the mammography image, is 5 megapixel, 5 million pixels. So you have to use a 5 megapixel monitor or you will not see the small micro calcifications you mentioned. So here we went up even more to the 12 megapixel, which is, you are seeing, it's a dual 6 megapixels. So you are seeing even more detail. You have 12 million pixel. So you are seeing more details about the breasts. So, and we are working in parallel in the market and always improving the quality of the monitors and the images. So this is what we do.
Thank you for this introduction and for showing us your monitor and your achievements. Eizo is a company that is equal to quality. I mean, it's a gold standard according to my opinion for the monitors. Anyway, I like the idea of the calibration of the self-calibration or program of the calibration of the monitors. My question is how much time needs the program to calibrate a monitor, first of all. And secondly, you popped up an idea while hearing you. We have, as a clinical auditor, I have to embed this self-calibration or calibration program to my questionnaire when auditing departments to see if their monitors have been calibrated and to ask to see the reports of the calibration. Yeah. That's very important to guarantee the quality of the services.
So your question,
my question is how much time needs
to
be
calibrated? Okay, thank you, Dr. Dimitris. So I did not mention before because we have limited time. So our monitor has built-in calibration here inside the bezel. So it will pop out whenever we send the calibration. So this is something we can do either on the client when we come and calibrate, or when we send remote calibration, it will auto-calibrate alone. About the time, the period, it takes around 10 minutes, I would say, as average to do the calibration. it will give you also the report. And also there are additional tests that needs to be done, not only the calibration. You have the uniformity test to check the uniformity on the screen. And there are sometimes, if you want, daily tests that the user should do, but unfortunately no one will do it, and no one is doing it because it's time consuming, and the doctors will not.
Maybe in night time.
But the user should do it. So the user in the morning, he should do some specific tests every morning, because sometimes you wake up, your eyes are tired. There are some details that you cannot see today, so you have to check. If you don't see, then you should not do any report or self-calibration.
Thank you so much for this lovely presentation, and especially the fused 6+6 megapixel monitor is really a lovely monitor. I have two questions. What is the lifetime of these monitors compared to other competitors, which average they have 5 years lifetime for their monitors, and whether you have the color monitor or not? So this is my question.
Thank you, Dr. Hashim. I'll start with your second question. It's faster. So these are color monitors that you see here. So we always recommend, with the technology advancing, we always recommend to the color monitors, because there are some tools that requires colors, as breast MRI, breast ultrasound, so they require color tools. So all these monitors that you see here are color, and even the name of the monitors, RX, it's color. So whenever you see RX, it's color. The grayscale, we call it JX. Yeah. So this is for your second question. This is a 3 megapixel. 3 megapixel, yeah. Also, the first number you see, it's the number of megapixel. Yeah. Your first question, lifetime. So this is, we're a Japanese company. We have a Japanese product, so it's very durable and reliable. Okay. We provide 5 years warranty, but our monitors works beyond that. So we have some installations in UAE where the monitors are installed since more than 7 years or 8 years. So they're still working, they still function well. But the question here, how much the technology progressed since 7 or 8 years? Do you still want to work on a product that is 7 years old or 8 years old? I guess it's better to change it at certain point to get you the best out of it, of the new technology and the new feature that we are we are creating.
But for those 7 years old or 8 years old monitors, how is the pixels, yeah, I mean the image quality wise. I mean, when you perform the QC, so what results you are getting? Are you getting the same outcome results that, okay, the image is still optimum, or there is some degradation of the image?
So we do the calibration for those the client that have the monitors, the old monitors. Either they are doing the calibration or they tell us to do the calibration, and we see some products, some monitors do not pass the calibration. So we do another test. If they want to if they don't pass, then we suggest and recommend to change the monitor, or we take it to repair, which is not logical, because the cost of buying a new monitor with 5 years warranty is better than repairing an out of warranty monitor. Yeah. But what will change, because the panel has a native color, black and white color. So what will change is the some brightness. So the brightness will be, let's say, if you put a new monitor next to an old one, you will see one is more going to yellowish. So because because the native panel is already it's aged. Yeah.
Thank you so much. Thank you.
Thank you.